The U.S. is seeing an increase in COVID cases. Nobody wants to hear that. Hospitalization rates, they are up more than 12% in the most recent week surveyed by the CDC. And in a sign of what could be ahead, COVID has been found in a rising number of wastewater samples. The virus is usually detected in wastewater up to a week before people start actually testing positive. CBS News medical contributor, that's Dr. Celine Gounder, is with us. She's editor-at-large for public health at KFF. Good morning to you, Dr. Celine. You know, people are going, enough already. We are so ready to move on. It's been a long time since I've really thought about COVID, but why are the cases going up and where?
Well, it's a combination of people letting down their guard. I think a lot of people think, oh, we were in this bunker during the pandemic. Yes. It's going to go away when I come out. And unfortunately, it is still there. So just because you think you're done with COVID doesn't mean that virus is not still circulating.
Letting our guard down how?
Well, we're not masking as much, for example, in public transportation. So on the plane,
I'm not masking anymore. Should we? Should we?
Well, if you're in a crowded indoor public space, you might want to in certain situations, particularly as we go into the fall, winter season. And where we're seeing it go up the most right now is in the Midwest.
Now, these hospitalizations are increasing. How severe are these cases?
They are, on average, not more severe right now. If you look at sort of ICU admissions, they're pretty stable. But where we have seen an increase in ICU hospitalizations, it's really in parts of the country where we have long-standing health disparities. The people who are ending up in the hospital or in the ER, they're two particular age groups. You have infants 0 to 1, who we know are very under-vaccinated. Less than 5% of those are vaccinated. And then people over 75, even if you have previously been vaccinated, that group really is at higher risk and needs to be boosted.
There's also a new variant, Eris. What can you tell us about that? And then do we have a booster that we'll have now to help protect us against it?
So Eris is a new variant. I don't think anybody should be getting really too worried about Eris. And in general, just because you hear about a new variant doesn't mean this is something to panic about.
That's good to hear.
It's just, and this is what viruses do. They mutate. You're going to have new variants emerge. It is very closely related to XBB, which is the most recent variant. The vaccines that are coming out this fall are fine-tuned for XBB and will provide good protection against Eris.
And the vaccines and the boosters are still crucial and key, aren't they?
Well, especially if you're in one of those high-risk groups. So people over 75, especially, but the elderly in general, pregnant women, people who are immunocompromised, people who live in nursing homes.
What about the kids?
And kids, a lot of kids haven't even gotten their first round of vaccination. So kids and infants really need to get their first round to protect them ahead of the fall and winter.
You've been saying that since the beginning, and that message has not changed. Thank you very much, Dr. Gounder.